initially joined the NHS as a clinician to provide pharmaceutical services. I was working under a medicines management team. Subsequently, I've become a lead, which means I do a lot more management, strategic work, and really horizon scanning and looking at the future in terms of how we develop our services. If you're not hungry for something, you'll never get there. So you have to be hungry for something, and also a realization of what your capabilities and your limitations are, and that will be a starting point for anybody who wants to get into leadership. So you have to look at yourself first before you look at external opportunities of what you want to achieve. When you look at where the population is in terms of the diversity of the population that the NHS serves, both diversity and the equality agenda are the most important things in terms of providing services. If we do put patients at the centre of everything, then actually diversity and equality has to be part and parcel of it. The NHS has had several changes, but I think some people would argue that in terms of seniorship and leadership, perhaps it's not represented in terms of diversity. And you could argue if that's the case, then where does equality set into it? A lot of the population or a lot of the staff that works for the NHS at the core level, the patient-based level, are very diverse. But as you move along up the pyramid of management, you see less and less diversity. So I think it's very important. If you're looking at quality, if you're looking at innovations, productivity and prevention, all of those, there's a pool of talent from the BME which can be sourced. And I totally believe that, the NHS needs to look at all areas of where resource is, not just the BME, I'm talking about at all levels, just to create a culture where people can develop themselves and provide the service at the end to the patients that counts the most.